So my name is Jeff Marin. I work at NIST. I'm an IT specialist.
And I'm Nick Keisters. I'm the Senior Advisor for Cybersecurity for HIPAA DC and OCR.
So we're going to talk to you about a publication that was released earlier this year, NIST Special Publication 866 Revision 2. Whoops, not that far. So the history of Special Pub 866 Revision 1 had actually been released back in 2008. So it had been many, many years since the Special Pub had been updated, and there have been a lot of changes to HIPAA in the meantime. So I was approached to update the publication. It's really all about providing a way or guidance for regulated entities to improve their cybersecurity posture while assisting in their compliance with the security rule. So the pub guides the organization through the process of understanding the security rule, how to conduct a risk assessment, a way to do a risk assessment, not the way to do a risk assessment, how to manage those risks, gives them some information about conducting self-assessments of their org, their compliance efforts, their cybersecurity posture, and provides quite a lot of resources in the appendices about identifying threats, resources that regulated entities can reference about a variety of topics, and a few other resources that were kind of mentioned in the previous session with Dylan about mappings that regulated entities may find very helpful. So I don't touch things about HIPAA. I am going to hand that over to Nick.
Thanks, Jeff. So just going to touch a little bit about the security rule more generally. So this document, it was a great effort that NIST and OCR collaborated on to update this. As Jeff said, it had been a few years since it had been touched. So there were a few things that were done. We tried to really put a greater emphasis on the risk analysis process and risk management, while at the same time, looking at different ways to help incorporate best practices and other materials to promote compliance and promote security, cybersecurity to better protect EPHI. But as far as the HIPAA security rule itself, and we talked a little bit about this, at least I did in some of the panels, it is broken up into different sections. We have the various safeguard sections, and we have administrative safeguards. So those are going to be things. That's where the security management process is. That's where your risk analysis is. That's where your risk management process is. That's where your contingency plan is, and data backups, and disaster recovery, and incident response procedures, and incident response processes. So a lot of administrative activities. Reviewing information system activity, having a security officer in place, a lot of those administrative actions are part of that administrative safeguards section. Physical safeguards, sometimes it may be close to being oftentimes this is missed a lot of times when we look at investigate entities for understanding their obligations and as far as having an accurate and thorough and comprehensive risk analysis process, as far as having that extend out into the physical space. There are physical safeguards, there are physical risks to EPHI and the facilities in which EPHI is stored and maintained. So those are things that physical safeguards seek to protect from that perspective. And technical safeguards. So technical safeguards has a lot of your somewhat classic cyber hygiene, things like access control and authentication, and addressing encryption for data at rest and data in motion, and timeouts for inactivity, and data integrity, and all those kind of things. So a lot of cyber hygiene type activities as far as implementing those technical controls, technical safeguards. We have organizational requirements. About business associate contracts and other arrangements. We have sections on policies and procedures and documentation that needs to be maintained. And one thing that's not on here that I did touch upon earlier in an earlier panel that I'll just insert is that there are Before the administrative safeguards, there's a section on general rules. So the general rules do apply to the entire HIPAA security rule. And as I stated previously, the general rules state that the covered entity and business associate, that they must ensure the confidentiality, integrity, and availability of all of the ePHI that they create, receive, maintain, or transmit. So when entities look through these administrative safeguards, look through these physical safeguards, and look through technical safeguards on how to implement them the best way for their environment, and using the risk analysis, risk management process to inform their decisions on implementing these various safeguards, that implementation should be done through that lens of ensuring the confidentiality, integrity, and availability of all of their ePHI. I'm over there?
Yeah,
right, sorry.
No problem.
All right, so just to continue on the overview of security rules. So the security rule is composed of standards and implementation specifications. Implementation specifications are basically guidelines on how to comply with the standards. Not all standards have implementation specifications. So where there is no specification, then that standard itself becomes the implementation specification. Implementation specifications are either required or addressable. All standards are required, but the specifications themselves are either required or addressable. That general rules section that I mentioned earlier, that does define what it means to be required and addressable, and required is the easy one that's required. The addressable one is a little bit more nuanced in that for some period of time, some folks may have equated addressable to optional. Hopefully, everyone here over this period of time, understands that addressable is not optional. That addressable is understanding, if the specification itself, if it is reasonable and appropriate to implement that specification in your environment to better protect ePHI, then you need to do that. So it is a process to go through to understand that what's reasonable in your environment and ensuring the protection of ePHI for those addressable specifications. But again, not optional.
I have a question, if I can ask. Didn't we say also that addressable means that in addition to determining if it's applicable to your environment, that you would implement something equal and appropriate to your environment? Is that a correct statement?
If the addressable specification itself is not reasonable and appropriate, then you would need to look to implement an equivalent alternative, where that equivalent alternative is reasonable and appropriate versus the addressable specification itself not being reasonable and appropriate. And as part of the definition in the general rules, that process has to be documented. So the rationale for deciding that an addressable safeguard is not reasonable, there needs to be documentation supporting that was your decision, that there was an affirmative decision made that this specification is not reasonable to implement under these conditions in this area to protect ePHI, and instead we're going to go for an equivalent alternative type of measure.
Okay.
All right, so one of the things I previously alluded to is that although the prior revision of 866 also talked about the risk analysis process, there was a greater emphasis and various updates to the risk analysis discussion. There were enhancements to the risk analysis discussion in the Rev 2 version. So we talk about, and I mentioned a little bit about this in the previous panel also, but just to reiterate, there are steps to prepare for the assessment and to understand the use of ePHI. And part of that, understanding the use goes to understanding, where ePHI is, how ePHI is used, essentially how ePHI comes into your environment, how ePHI either enters your environment, how it's created within your environment, and then how EPHI is used, how EPHI moves, how it flows throughout your environment through different information systems, different departments, different media, different networks, different devices. And then, finally, where it's applicable, how EPHI, what its final disposition is, how EPHI exits the organization, how EPHI is disposed of in the organization, and what are the risks to EPHI throughout that, essentially, EPHI life cycle. And, depending on where the EPHI is within that flow, those risks are going to be different. So you need to really understand, again, goes back to what was communicated earlier, it really goes to having a good understanding of your environment and being able to analyze it from the perspective of, in my environment, in my entire environment, what risks are posed to EPHI and what can I do to mitigate those risks? So to do that, you need to identify those reasonably anticipated threats and hazards. You need to identify vulnerabilities that could be exploited, and these are going to be non-technical vulnerabilities. These could be those administrative procedures and policies. These could be technical vulnerabilities, so things that are flaws or mistakes or misconfigurations of systems that could be exploited. What is the likelihood of a threat exploiting a vulnerability? What is the impact of that? And using all of that to, determine the level of risk. One of the things that, sometimes that we see, and we have a newsletter on this, on some of the differences between a risk analysis and a gap analysis. Sometimes when we ask for a risk analysis, instead what we receive is a gap analysis. It is a view of, is the organization complying, with HIPAA requirements versus, what we're really looking for is does the organization understand what the risks are to EPHI? And there's some overlap because there's some of the different elements of the security rule, they are designed to reduce risks in various risk areas like compromised credentials by unauthorized users and whatnot. But those are some of the issues that we see when we do our investigations. And one of the things that we look at is to understand that the entity did determine the level of risk. So if we see a level of compliance rather than a level of risk, and that's something that may deserve a little bit deeper dive into what's going on there. And then also, documenting your risk analysis results. So, we are going to ask for your risk analysis, in most investigations that involve the security rule, so that we understand, that you understand your environment and the risks your environment poses to EPHI, and we are going to, want to have that understanding. One of the things that sometimes we see is that understanding is not well conveyed. That some of the reports that we get, the results that we get, are summary reports, they're executive reports, they're PowerPoints to a board of directors. They are results in the aggregate of various systems and various threats and risk areas. So, the reg text says that the risk analysis must be accurate and thorough. So when we get an executive report that's a PowerPoint that has one or two lines that are kind of sandwiched between that, we have a risk of people leaving the organization because we pay our call center staff too low on an hourly rate. And then we have a line that says we're at risk for regulatory action, due to a breach of EPHI because of all the risks we have. That one or two lines in a larger, risk assessment of the organization as a whole does not convey to OCR that you understand your environment, that you understand your risk to EPHI, so that ultimately that you're not understanding what you need to do to protect your EPHI.
Oh, sure. These are just some tables included in the pub. I would stress from this Section 3 risk assessment, just providing a way for orgs to conduct a risk assessment, not saying that's the way. The steps you saw on that previous slide are pretty much taken straight from another NIST Special Pub 830 that was published by our risk management framework team. They do the 853 security controls. So ideally, what you would have at the end of your risk assessment, you'd have reasonably anticipated threats. You would have an understanding of vulnerabilities that those threats could exploit. You'd have an understanding of what is the likelihood of each threat exploiting a vulnerability, and what would be the overall level of risk to that threat vulnerability pair. We're interested in threat vulnerability pairs in this particular example. And so down in the bottom right corner, with your threats and your levels of impact for those pairs, you'd have some pretty good ideas. Am I talking about a low risk here? Am I talking about something that's maybe a moderate risk, or something that's a high or a very high risk to EPHI in our organization? And after you have that understanding, it's much easier to manage those risks. So Section 4 of the Special Pub 866 talks about, okay, so we've done this risk assessment, we've identified threats, vulnerabilities, we have an understanding of the level of risk for each of those pairs. What do we do now? And we talk about, we're borrowing from some other NIST pubs, about enterprise risk management processes. So executives in the organization will have an understanding or make some declaration about what is the level of risk tolerance in our organization. There may be some orgs that they're not willing to tolerate anything a moderate or higher risk. So that just tells you right off the bat that in your risk assessment, if you've identified any risks to EPHI that are moderate or higher than that, you have to address them in some way. So this Section 4 of the Special Pub 866 talks about that process. So which threat vulnerability pairs do we have that exceed that level of organizational risk tolerance? And after we've implemented all the standards, implementation specifications, do we still have those threat vulnerability pairs that are at or above organizational risk tolerance? And that tells us that we may need to implement some additional security controls. And in the Section 4, we encourage orgs to consider that your organization may be implementing many other types of controls, not just security controls, maybe organizational controls of some other sort. Maybe those other controls or processes in place can help to alleviate or mitigate the risk to EPHI. So it's that continual cycle of balance, assessing risk, implementing standards, implementation specifications. Maybe there's more controls we have to implement, reassessing risk to get it below the risk tolerance level. And then ultimately we talk about if there's practices or something's in place where you cannot reduce risk to EPHI to organizational tolerance levels, you may have to consider like re-engineering or stopping certain business processes or practices to avoid that risk. So is that a correct statement? I want to make sure I don't say anything wrong about HIPAA.
Well, I think that's right, but I think maybe another example could be legacy devices. So you have those legacy devices where maybe there are certain mitigation steps that you would want to take, certain steps that may inform decisions on compliance with other parts of the rule, maybe some of the technical safeguards, maybe legacy devices are not supported in a way that allows some implementations that the organization should do. So in those situations, and we talked about this in one of our cybersecurity newsletters, which are available on our website. We have one on solely on legacy devices. So we talk in there about where there are those risk areas that because it's a legacy device for whatever reason that certain risk areas cannot be reduced in a sufficient way to meet the requirements of your risk management process under HIPAA. Then you have to do something else. You can't just throw up your hands and say, well, this is an unsecured device that's in our internet-facing firewall, and hope nobody breaks into it. But I'm kind of reminded back when I was used to be out in the field quite a few years ago, and going to an optometrist, and they had and this wasn't all that long ago, maybe 7, 8 years ago, but they were. And I forget the names of the devices, some kind of Octa, I don't know, but it examined your eyes, and it was running Windows 95. So Windows 95, and this was, in the, in the, the 2000 teens, and it was on their network, and they would, take pictures of your eyes or do whatever, and then they would, transmit that data to a file share to upload in their EHR system, and there were no passwords or anything on a device or whatever like that. And so I was trying to convey, to the ophthalmologist, the sense of issues that he had, with this machine. And one of the things I think Jessica mentioned earlier is that, or maybe it was Rahul. I think it was Rahul in one of our first sessions. He mentioned, just because it has an Ethernet port or has Wi-Fi on it doesn't mean it needs to be on a network. So with all of the issues that are unable to be corrected as a network device for this Windows 95 system, pull the Ethernet plug. Find a different way to, get your information into the EHR system. If it's, SneakerNet through, copying your stuff on a USB drive, that's maybe self-encrypted, and taking that over to your NT server. Even though, your password capabilities are weakened, somewhat broken in Windows 95, put them on there anyway. It's better than what you have right now, which is nothing. Lock the doors, have physical safeguards in place, but you just can't have, an unauthenticated network device just laying around and say, what am I going to do? It's a legacy device and people are going to break into it. Now, there are things you can do, and what you can do is going to be based on, understanding that device, understanding the risks that that device poses to your EPHI, and then taking the appropriate steps to mitigate, those issues.
Thanks, Nick. And just like with risk assessment, you have to document your risk management activities, how you're managing and handling different identified risks. Is this you? I can't remember. Well, I'll just talk briefly. Section 5 of the pub, we view it more of a way for orgs to do a self-assessment of their organization. So for each of the standards, we have a table, and we identify some key activities. For this standard, what are some typical activities that an organization may implement to help them, achieve that standard outcome? And then also in those tables, I'll show you some examples here shortly. A little bit more specific descriptions. What are more specific, ways that those activities may be implemented in an org? And then we have some sample questions. So if I'm an org, what are some questions that we can ask ourselves to introspectively assess how well we're complying with this standard? So here's some. Do you add anything to that before I go to the next slide?
No, you can go to the
So
next
here's
slide.
some examples from the pub. Can you? Hope that's not too hard to see. So this is an example from security awareness and training. We have the HIPAA standard. This is just one of the tables. What are some key activities? What are some more specific descriptions? And then on the right, if we're an org and we want to make sure we're trying to make sure we're in compliance with security awareness and training, what are some questions we can ask our org to kind of get a feel for how well we're in compliance? But this is more informative, not an exhaustive list of questions. Just because you answer yes to questions in the right column doesn't ensure that your organization is compliant with this standard. It's just, gets you pointing in the right direction, I would say. Anything you want to add to that?
Sure. So, a lot of these descriptions, all these questions, so these were looked over from the prior versions to the new revisions, so there were definitely taking into consideration the current threat landscape, the current state of the industry as we rework some of these questions. There was a rather extensive, I believe, multiple layered public comment process that went into this revision. So a lot of those different comments, some of those reflected some of the sample question descriptions. So Jeff and I and others looked over those and incorporated some of those concepts as were relevant in the document. Looking at the security awareness and training standard, I'm just reminded, I think we saw a question from a remote user come by. I think it was after Rahul's session had ended, because Rahul had talked about the issues of phishing, the risk of phishing through an organization, and making sure that that's important for organizations to understand, to educate their workforce on the issues, the dangers of falling for a phishing attack. So that could go to part of that as a security and awareness training program to provide security awareness to your workforce regarding phishing attacks. different types of phishing attacks, new variants of phishing attacks, so that they're familiar with it. And I think the remote question had to do with, what type of, training, phishing type training, could help in that. And one of the implementation specifications under security awareness and training is for periodic reminders. So having security reminders, remind your workforce members periodically for security. And so, it's almost tailor-made, one of the things about phishing, having the simulated phishing exercises. Either using a vendor or something that is going to put those out. They're going to send essentially fake, I guess they're fake anyway, but I guess fake in a good way, a fake phishing email to your workforce members, and trying to understand, who's going to fall for that, who is going to click on those fake phishing emails, and then for folks that do click on them, you can take some kind of action. So you can provide some kind of additional remedial security awareness and training, or other activities to help to counsel them, to understand that they're placed in the organization as one of the front lines of defense for cybersecurity, as a workforce member, and to kind of express upon them the importance of that, the importance of these training exercises, and that when they do fall for these phishing attacks, that it's serious business. It introduces malware, it introduces ransomware in your environment. So conveying that sense of importance and having some type of way to model and to gauge the effectiveness of training is going to be very useful. And that periodic reminder, that security reminder specification seems almost tailor-made for simulated phishing.
Mm-hmm. Yep, absolutely. I'm just going to zip through some of these. We have a couple other examples. This one's about person or identity authentication. My eyes are not very good.
Right, and before you just jump away from that, Jeff, I will just, authentication is kind of a favorite topic of mine. Talked a lot about authentication in various documents and videos. With OCR of late, we have a cybersecurity newsletter that is devoted to authentication, and again, it really goes to understanding your environment. One of the things that frustrates me, as I interact with and maybe help some of the investigations from time to time, is when there is a compromise, a breach of a healthcare organization, and it is due to compromised credentials. So either there was a password spraying, there was a brute force attack, someone got some passwords off the dark web through trading or buying or something for whatever, but there was the bad guy had the password, or they discovered a password for brute force, and they were able to to relatively easily get remote access into the system. And one of the ways they were able to get it more easily was because it was single-factor authentication. There was no multi-factor authentication. So although, as we said earlier, the security rule is scalable, flexible, technology neutral in order to accommodate new technologies and new and emerging threats, so it's fairly non-prescriptive. And in that vein, the authentication standard is also non-prescriptive. It does not require a specific type of authentication, a specific format for password rules. But as we started out, the general rules of the security rules say that when you implement these different safeguard areas, when you go through your risk analysis to inform your decisions on how to implement, that decision-making process needs to be done through that lens of the first general rule. Must ensure the confidentiality, integrity, and availability of all of your EPHI. So from the authentication standpoint, again, your environment, where are your authentication touch points? It's not just Active Directory. What types of VPNs are you using? What scheme do they use for authentication? How about different Unix boxes? What are they using, or Linux boxes? Infrastructure tools. Web application server, or a database admin consoles. What are the storage access networks and virtual machine configurators and monitors. So all of these things could have different authentication schemes. They could have individual authentication schemes, but you need to understand that, because even though maybe your virtual machine manager or your storage area network manager, maybe that console tool doesn't have EPHI on it. It is managing devices, managing software, managing systems that manage the integrity and availability and even confidentiality of the EPHI. We did have one case from a few years ago where it was a workforce member, it could have been a contractor. He managed a system administrator type person, and he was let go, and his access, well, some access was terminated, in accordance with HIPAA's termination procedures for access to EPHI. What wasn't terminated was his access to the disk storage management software system. So he had left under strained, bad circumstances. So he went back onto the system and he deleted all of the configuration data for all of their disk management. So all of the EPHI, all of the data on there was all gone. The data structure that supported the integrity and availability of all of the EPHI and other data was all gone because they had not understood the depth of their organization to be able to understand that, oh yeah, we have touch points not only for here, this remote access point, but also for RDP and also for this console for our disk management subsystem. So again, understanding your environment and applying the appropriate mitigation strategies for different areas in the context of authentication. We kind of go through it quite a bit in that newsletter. I'd encourage folks to look at that if they haven't already to understand some of that.
Good stuff.
Okay, 5 minutes.
Oh, did I go too far? Oh, no, that's good. Oh, just a couple of appendices that I want to highlight in the special pub. These are all online. There's very short appendices in the doc that points people online, pointing to a NIST resource, cybersecurity and privacy reference tool. It's another online resource that we're setting up. What we wanted to do here was take those sample questions, descriptions, activities from Section 5 of the pub, take some mapping information we have, because we have a mapping from the HIPAA Security Rule standards and implementation specifications to cybersecurity framework 1.1 subcategories and security controls from NIST Special Pub 853. So if you use security controls from NIST SP 853, we have mappings from those controls to implementation specifications. This CPRT reference resource online is a way to put that all in one place. So you can see all for each of the standards. You can see the sample questions. You can see the activities. You can see the descriptors. And you'll see what are the mappings from those implementation specifications to controls and CSF subcategories. So that's all in one place in this CPRT tool. Oh, I better talk about this very fast because there's a question that came in online that I think people want to hear about. This is another view of the same thing, CPRT. I mentioned in the last session with Dylan, OLEAR, online informative references, taking all these mappings that used to be embedded in static documents, we're putting them online. We've got lots of mappings now. So maybe you're a entity that uses a different controls catalog. Maybe you use something like critical security controls or whatever you happen to use. We might not have a mapping exactly from the security rule to whatever you're using, but we've got lots of mappings on this OLEAR. That's an active link on that slide. Once we put the slides on the event page, you can just click on that link there. It'll take you to all the mappings we have. Yeah, I probably don't have much time to say more about that, but very useful to people. And then lastly, the last appendix of the special pub, 866, resources that we want to compile, topical-based, maybe 15, 20 different topics that stakeholders are very interested in. Cloud, how do you get vendors, authentication, listing all kinds of, whether it's NIST pubs, different federal agency pubs, putting them all by topic in one place. So that's just showing you on that, the image at the bottom of the slide is showing you the event the page for the document, and that highlighted area is where you click to get to the resources. Nick, I think there's quite a few questions online, people asking about doing risk assessment. I think I better ask this question because I think it's important. Can OCR publicly share an example of what an appropriate risk analysis looks like? A model analysis would be immensely helpful, especially for small covered entities. And along that line, people asked about the SRA tool.
Sure. So, ONC and OCR have collaborated on the SRA tool, which is, geared towards those smaller organizations. One of the first of all, as far as the risk analysis process itself. So, there is no, prescribed, form or format that the security rule itself, requires entities to partake. In our risk analysis guidance, we did step through some risk analysis steps using the SP 830 as an example, and using that because a lot of the actions that Jeff, that you outlined previously, those are pretty common examples, common steps that you would take when you do conduct a risk analysis. In the example of the security risk assessment tool, and just different risk analyses in general, and different tools in general, is that these tools and these products that they're really only as good as the work that's put into them. And doing a risk analysis in an accurate and thorough, in a comprehensive way to understand your environment. That can be hard work. For smaller organizations, there's a smaller technology footprint. So in that respect, it's a little bit easier, but you're also less resourced. So you also don't save that much that way. But if we did some type of one of the dangers of having like a model risk analysis, and we talk about this in some of the preamble language of the security rule, is that there's just such a wide variety of HIPAA regulated entities. So we're talking not only about small entities and potentially large health systems, but also their business associates. They also have to comply with the security rule in its entirety, including the risk analysis. So the variety and the scale and scope of those things make it difficult to have that kind of one-stop shop example. The SRA tool is somewhat an example of that, and we have had to every year that we have webinars on the use of the SRA tool as we update that. And one of the things that we see when we get some of our sponsors back, and we try to impart on folks that are using the SRA tool or any tool, is going back to what we said before, is that to have what you submit to OCR to be able to convey that you understand your environment and risk to EPHI. And when you use a tool, including the SRA tool, where it's more of a questionnaire-based tool, where your responses are yes, no, 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 yes, no, that doesn't do it. That doesn't convey that you understand your environment, that you understand what the risks are at the EPHI throughout the EPHI life cycle. So we've taken great pains to include some of that information in the user guide for the risk analysis, rather the SRA tool, so that people understand that they do need to do that extra work, that there are places within the SRA tool for various free flow text boxes to explain what risk areas may have rolled up as an aggregate, so that they can be disaggregated within a text box to convey that sense of thoroughness. That there is the ability to include and attach supplemental documentation to the SRA tool to be able to keep track of, because as a point-in-time questionnaire-based tool, it's probably not going to capture all the potential risks to any particular type of organization. There will probably have to be some supplemental documentation. And as is explained in the user guide, as a questionnaire-based tool, it doesn't do a good job of identifying technical vulnerabilities. Flaws and holes in systems, misconfigurations of systems, having to identify those. We've had various cybersecurity newsletters where we talk about ways to do that. So again, security rule is not prescriptive. We don't say a way to do that in there, but in our newsletters we do. A vulnerability management program, penetration testing, subscribing to one of the information sharing and analysis centers, subscribing to the HHS HC3 listservs or to the CISA alerts. There has to be a way that you can identify technical vulnerabilities in your environment and having those incorporated into your overall risk management process so you can mitigate those types of risks.
Okay, good stuff. Sorry, we went a little bit long, but this is an official break time. You can get coffee. I think there's some snacks or some afternoon down in the East Wing. But I think we do need to start back up again at 2:35 Eastern Time.
Produced by the U.S. Department of Health and Human Services.